Good afternoon, everyone. I'm very excited today to present our study, the very long title, The Comparative Effectiveness of Sleeve Gastrectomy versus Roux-En-Y Gastric Bypass in Our Patients Giving Birth After Bariatric Surgery, specifically examining reinterventions and obstetric outcomes. All right, I'm currently a PGY3 at Yale, and I just completed my research years at University of Michigan and the VA in Ann Arbor. Because of that, I have to disclose that the research today does not reflect the views of the United States government. Every year, women of childbearing age, ages 18 through 55, comprise approximately 65% of our bariatric surgery population. And despite this large group of our patients who may be conceiving close to bariatric surgery, very little is known about what happens to women who give birth in the first 2 years. Current consensus guidelines from the American College of Obstetricians and Gynecologists suggest waiting between 1 to 2 years prior to conception. And this is because this is a purported high-risk time period for both mother and fetus. However, information about surgical risks, reinterventions, and obstetric outcomes remains unknown. The studies that we currently have are limited in two major ways. One, they tend to be single institution and thus are limited by small numbers. And two, they mostly focus on patients who have undergone Roux-En-Y gastric bypass. And thus, we ask the question, within women who are giving birth after bariatric surgery, is there a difference in reinterventions and adverse obstetric outcomes based on procedure choice between the two most common procedures performed today, laparoscopic sleeve gastrectomy and Roux-En-Y gastric bypass? In order to answer this question, we used MarketScan, a US commercial claims database that covers approximately 40 million enrollees every year. We examined female patients ages 18 through 52, and we chose that so that there would be a full 2-year follow-up for all of these patients. And we looked at patients who underwent laparoscopic sleeve gastrectomy or Roux-En-Y gastric bypass from the years 2011 to 2016. We then performed a multivariable logistic regression, first performing inverse probability weighting for procedure choice, and then applying that weight to our logistic regression, also adjusting for age, US state, and either LX or comorbidities if we were looking at our surgical outcomes, and Bateman comorbidities when examining our obstetric outcomes. For our surgical reinterventions, these are the ones that we specifically examined. And for our adverse obstetric outcomes, we look at pregnancy complications, severe maternal morbidity, and delivery complications. Within our 5-year study period, we found that 1,079 women in this database gave birth in the first 2 years after bariatric surgery, 673 of whom had undergone sleeve gastrectomy, and 406 of whom had undergone gastric bypass. When we look at all surgical reinterventions combined, we found that procedure choice, sleeve versus bypass, was not associated with the higher odds of reintervention. We then use our logistic regression to examine adjusted rates for each of the reintervention outcomes. And for outcomes that had 5 or fewer cases within the entire study period, we report the unadjusted or actual outcome rates. And these are all noted in our results section with an asterisk. So as you can see, adverse surgical outcomes are rare in women who are giving birth in the first 2 years after bariatric surgery. There are fewer than 5 cases for all of these interventions that are listed here. We then looked more closely at subtypes of reoperations, and only one of these, biliary procedures, had a more than 1% adjusted rate in both sleeve and bypass cohorts. And as you can see, the adjusted rates were not significantly different here as well. Turning to our obstetric outcomes, we similarly found no difference between the two procedures when examining our adjusted outcome rates. This was true for gestational diabetes, the spectrum of hypertension during pregnancy, iron deficiency anemia and hyperemesis gravidarum. These are severe maternal morbidity outcomes. And lastly, our delivery complications. So in summary, we did not find a significant association between procedure choice of sleeve gastrectomy versus Roux-En-Y gastric bypass and adverse bariatric surgery-related and obstetric outcomes for these women who gave birth in the first 2 years after bariatric surgery. Our study has few limitations, which include that we use an administrative database, and so we do not know the clinical nuances of each of these cases and are unable to comment on the severity of the outcomes. We also do not have BMI or weight information, which of course is important in our bariatric surgery population and for watching these patients long-term. Second, all of these patients are privately insured, and so we cannot comment on patients who are uninsured or covered by Medicare or Medicaid. And lastly, we know that in the United States, race and ethnicity, as well as socioeconomic status, have a profound effect on maternal outcomes. And unfortunately, these data are not available to us in MarketScan, but will be an important area of future study. So in conclusion, we found there's no difference in the risk profile between sleeve gastrectomy and Roux-En-Y gastric bypass in the first 2 years for women who are giving birth. And important next steps will be including further understanding of the role of fetal outcomes, the role of maternal weight loss during this time period, and intentionality of pregnancy, all with the goal of better informing our shared decision-making conversations with our patients regarding the choice to conceive after surgery and what the risks are to mom and fetus. I'd like to thank Dr. Tellem for her mentorship on this project, as well as my study team members, Drs. Yang, Peel, Thumma, Dimmick, and Arterburn. And I want to thank the National Clinician Scholars Program for funding my research time and the Veterans Affairs for supporting my research. Thank you for listening, and I'm happy to answer any questions.